Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us once again here on Health Professional Radio. In this segment, we're going to be speaking with Dr. Clayton Lau. He's joining us here, Division of Urology and Urologic Oncology at City of Hope. City of Hope is a leading-edge cancer research and treatment organization. Dr. Lau is joining us to discuss how prostate-specific membrane antigen, or PSMA, PET scans significantly improve prostate cancer detection and treatment. Welcome to Health Professional Radio, Dr. Lau. Thank you.
Good morning. Thanks for having me.
Well, we did talk a bit about your area of expertise. Give us a little insight into who Dr. Clayton Lau is.
Great. Well, thank you. I'm currently the Chief of Urology and Urologic Oncology at City of Hope, which is a NCCN-designated cancer center in Southern California. We have a very large group of 20 urologists that we specialize in urologic oncology, cancer survivorship, and just general urology. Also, we do other things specialized in urology, such as infertility and female pelvic medicine. But I have a blessing of leading a group of a lot of really fantastic physicians, surgeons, and researchers here at City of Hope.
Was urology your first love when you went into medicine?
You know, frankly, when I was a medical student at Tufts in Boston, when you choose your specialty, all I did know is that I really kind of liked a lot of different surgical specialties. But when it comes to picking out a specialty within surgery, it really depends on your mentors. And I really had fantastic mentors in urology, and then that's how I got kind of guided into urology. At first, it's interesting, funny story, being an ex-athlete, I thought I was going to go into orthopedic surgery. But after watching orthopedic surgery, scrubbing in those cases, I just didn't think it was for me. So I looked at other things like transplant surgery and urology and ENT surgery.
I mentioned PSMA PET. What is prostate-specific membrane antigen, and is it better than the go-to, and if so, how?
Yeah, standard of care imaging we do for most prostate cancer patients is traditionally a standard CT scan and a bone scan. Unfortunately, with those scans, unless it's something bigger, like a centimeter in size, sometimes it has a hard time picking up metastatic lesions such as lymph nodes or metastatic disease in specific organs in the bone. But PSMA PET has a much higher sensitivity in picking up prostate cancer, and specifically the tracer is bound to PSMA, which is overexpressed in prostate cancer. And so there are different versions, including the gallium, PSMA PET, and the Pylorify, PYL. But they both work really much better than standard of care imaging to identify prostate cancer. The way we use the PSMA PET now is traditionally we can use it for patients that have had treatment with radiation or surgery that recur or have a PSA recurrence, and we can help localize better with this sort of imaging. And with that information, we can directly treat those specific areas and have an idea of what treatment options are available. For instance, if a patient has widespread metastasis, we know that they're going to have to get something that's more systemic. If something just localized in one or two specific areas, we may do a specific targeted stereotactic radiation, just those areas. So it gives us more information on how to customize the treatment for a patient.
At City of Hope, you perform single-port robotic prostatectomies. What is that procedure? Is it unique to City of Hope? And explain some of the benefits.
Yes, robotic surgery has really taken the forefront in urology and internationally. Honestly, City of Hope has been one of the busiest robotic surgery centers in the world. We use it from anything from urology, colorectal surgery, thoracic surgery, general surgery, and even ENT surgery. The urology program obviously is one of the biggest in the United States. Robotic surgery is usually done through multiple ports, 4 or 5 ports. But the single port robot puts everything through one small cannula. And just improvement in technology and optics. And the advantage is basically cosmesis, the ability to work in a small space, so hopefully less trauma and traction. We're one of the only 100 centers in the United States that actually have a single port robot. And we've done many surgeries, mostly prostate surgeries, but we've even done kidney surgeries and bladder surgeries with it. It's Prostate Cancer Awareness Month, September, But, in terms of prostate cancer surgeries, we've done, as a group, we've done over 10,000 surgeries here at City of Hope.
Being that busy with so many surgeries, is every prostate cancer patient a good candidate for that type of procedure?
Absolutely. I think there's always a select number of patients that actually have a prostate cancer surgery. So these are patients that are healthy, have a life expectancy likely 10, 15 years, have localized disease, but also have disease that's somewhat, at least what we call intermediate grade or high risk. For instance, if a patient has low-risk disease, small amount of cancer, many of those patients can be just watched, what we call active surveillance, because many of those patients won't succumb to the disease or have any spread in the next 5 or 10 years. Mm-hmm. This has changed the paradigm of how we treat prostate cancer, throughout the United States over the past 5 or 10 years.
Now, when I think of surgery, I think about long recovery time, maybe a little physical therapy. Does this robotic surgery require the same type of recovery time and physical therapy, or is it basically an outpatient procedure?
Oh, yes. So essentially we're doing the same operation. We're removing the prostate and the lymph nodes. But with the robotic approach and with experienced centers and surgeons, the surgery usually takes about 2 hours. Most people actually go home the same day. They usually are outpatient surgeries and same-day discharge if everything goes well. And what we're finding is that patients, are back to work sooner, more comfortable. More people are actually more comfortable at home than being in a hospital, and they feel safer at home. But this is one of the advantages of robotic surgery in 2022 now is that, and especially at City of Hope, is many of our patients are done on an outpatient basis.
You mentioned when things go right. What about some of the complications from prostate cancer surgery? And if you would talk about some of the lifestyle changes that you might have to make post surgery. So
complications are pretty uncommon in prostate cancer surgery in terms of the major complications. Bleeding is pretty uncommon, where the need for blood transfusions less than 1%. Heart attack and blood clots, those are pretty uncommon, especially robotic surgery, because they're much more efficient, less blood loss. The things that are more common with prostate cancer surgery, over the last few decades or for 100 years, is basically the things that people worry about are incontinence and erectile dysfunction. Thankfully for the incontinence, it's pretty uncommon to have long-term incontinence. Only about 3 to 5% of patients will have that long-term incontinence, depending on their age and their health and the size of their prostate. It might take a few months to get that continence back, or the urinary control, but they should get it back within a few months. The erectile dysfunction is probably the more common thing. If you have a really healthy person who's under the age of 55, the chance of regaining their erections and they're healthy is probably around 80%. For patients that are older or have some medical issues or needing a Viagra or any other medications for their erections, obviously the rate goes lower. Well, thankfully, there are a lot of medications and therapy programs one can do before and even afterwards to help with recovery. So when we're talking about patients that have surgery, things that are important to do, I encourage people to do is to start doing their Kegel exercise beforehand, and even afterwards consider doing physical therapy to help strengthen the pelvic floor, like doing pelvic floor exercises or Pilates, yoga type exercises to help out. The erections, we actually want to have patients go on a potency rehabilitation if they're interested in potency afterwards, is to put them on a program or regimen where we put them on medications and have them be active a few times a week, and monitor them and make changes to medications and change the doses to help them speed up the recovery.
You mentioned that September is Prostate Cancer Awareness Month. I'd like to remind our listeners that about 1 in 8 men will be diagnosed with prostate cancer in their lifetime, which is also the second leading cause of cancer deaths in men. Is there a website where our listeners can learn more about what goes on at City of Hope?
Oh, absolutely. You can go to the website www.cityofhope.org, and there's a lot of great information there for prostate cancer in our program here at City of Hope.
Clayton, it's been a pleasure. Thank you so much for joining us here on Health Professional Radio and telling us about City of Hope and the surgeries that you perform there.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Clayton Lau. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.